everyone, my name is Azuri Najwa. I'm a pharmacy student and today I'm going to give some information about the routes of drug administration. There are three types of routes. Firstly is the enteral route, which is by the mouth. Second is the topical routes, which is on the skin and the mucous membrane. And lastly is the parenteral routes, which is by the injection. So here is the overview of what the drug administration means. But before that, let us see what are the factors that influence the choice of drug administration. Firstly is the dosage form of the drug, either liquid, solid, semi-solid or gas. Second is the patient's condition, either conscious or not. Third is the patient's age from newborn to elderly. Fourth is the duration of action, either slow or long. And lastly is the site of drug actions. The first route is enteral routes, which is by the gastrointestinal tract. For example, oral, which is by the mouth, where the drug is swallowed, chewed, and allowed to dissolve in our mouth. Advantages of oral drug administration. First, it is the most convenient since patient can self-administer at home and also pain-free because we just need to swallow it. And third, it is cheaper since we doesn't need any special devices, therefore we doesn't need to sterilize it. And lastly, it is safer because it doesn't cause bleeding or tissue damage like injection and also reduce the risk of infection. Here are some disadvantages of oral drug administration. First, it undergoes the first pass metabolism and has low bioavailability and also slow onset of drug. Third, it has unpalatable taste of drug and require patient cooperation, especially for children. Lastly, the drug absorption may vary because of the destruction of gastric acid and digestive juice in our stomach. Next is parenteral route, which is injection into the cardiovascular circulation, either injection or infusion. For example, subcutaneous administration under the skin, which is we inject the drug into our fatty layer. And most commonly is insulin medicine. What are the advantages of subcutaneous administration? First, it avoids first-pass metabolism as has high bioavailability and has low risk of systemic infection. And third, it is painless since we inject onto our fatty layer and patient can self-administer at home as it requires minimal skill. And lastly, it is useful for slow absorption of drug like flupentisol. Here are some disadvantages of subcutaneous administration. First, the injection site must be changed frequently as to avoid accumulation of unabsorbed medicines and will also expose the microorganisms. Third, we need special devices like the needles and we need to sterilize the tools frequently. And lastly, the medicine can only be administered in a small volume as big volume doses of drug is less practical. Lastly, topical route, which is the application onto the skin or mucous membrane. One of it is inhalation, which is the drug gases is absorbed through the alveoli of the lungs, and this is to treat the respiratory diseases like asthma. Advantages of inhalation administration. So first, it has rapid onset of action and also offers medication delivery directly, especially to the site of action. And third, it has fast absorption because of the large surface area of the organ and avoid first-pass metabolism. And lastly, it reduces the systemic side effect as it only affects on the target organ. Disadvantages of inhalation administration. Firstly, it will cause irritant effect on airways and also could trigger the cough response. Then it needs special devices like inhaler that may be very costly and also need proper inhalation skills. Lastly, the medicines can only be administered in a small volume. That's a wrap. So this is the summary of what we have learned today. But I want to note that it is not the only way of routes of drug administration. There's a lot of more for each of it. So one type of drug can be administered in a lot of forms. Therefore, we must choose the best routes to deliver the drugs to the patients. As no single method of drug administration is ideal for all drugs in all circumstances. So that's all from me. Thank you for watching.